Welcome to the Dentist News Network. I'm Scott Drake. My guest today is Dr. Roger Briggs with Briggs Family Dentistry in Scottsdale, Arizona. Dr. Briggs, thanks for joining us. Welcome back.
It's good to be here.
Doctor, new studies have shown a connection between stress and overall oral health. Can you talk about that and the connection between the two?
You know, stress is one of those things that affects us in so many ways. I mean, it can make your hair fall out under extreme stress. You can develop colitis, you can develop skin diseases, and it's exactly the same thing inside the mouth. In fact, we can oftentimes tell when a person is under stress without them ever saying a word just by looking in their mouth, especially if you're familiar with it. And it really affects us in a couple of ways. One can be mechanical. There's a lot of studies that show that stress can lead to a lot of extra grinding of our teeth, and we call them parafunctional things that we do with our mouth that are outside of normal. And then the other aspect of stress, it can lower our immune system. And when our immune system is lowered, then the bacteria that would normally live in our mouth and be controlled can begin to invade and create disease in the gums and the bone. And so stress can affect us in a lot of ways.
I think many people always think of stress as being something emotional, but there are physical stresses too, like lack of sleep, for example.
Absolutely. You know, we've talked about how sleep disorders such as obstructive sleep apnea, when you can't get proper rest and proper oxygenation while you're asleep, that's a stress. And one of the side effects of that is that people will do an inordinate amount of grinding of their teeth. And so stress can be a nutritional aspect. And certainly when we look at oral health, we look at things that can be affected there because of lack of proper nutrition. You know, if people lose teeth and they have pain in their mouth, they don't feel like eating those carrots and vegetables like their mom told them to do.
Dr. Briggs, what signs do you look for that stress might be playing a part in someone's oral health?
Well, one of the things with what we call gum disease or periodontal disease, if there's any abnormal bleeding in your mouth, especially when you floss and when you brush, and certainly that needs to be looked at by a dentist. When we start having teeth that feel loose, loose teeth are oftentimes that way because of bone loss, or they can be that way just because you're doing some parafunctional things and putting some undue forces on those teeth.
Dr. Briggs, how can someone reduce the effects of stress on their oral health?
Yeah, certainly you want to start with an evaluation by a professional. Stress, you know, one of the things that is evidence of stress is bacterial invasion of our gums and the bone around our teeth. So good home care and good proper instruction is just like your golf swing. You know, when you're hooking and drawing that ball, you want to have somebody check your swing. And when you got bleeding in your mouth, you want to see a dental hygienist to help you make sure that you're properly caring for your mouth. Nutrition is a big aspect of stress. And just like any other health issue, you know, a good walk in the park for a half hour a day and smell the roses, those things can make a difference in your oral health too.
All right, thank you, Dr. Briggs.
You betcha. It's good to be here again.
My guest has been Dr. Roger Briggs with Briggs Family Dentistry in Scottsdale, Arizona, and you're watching the Dentist News Network.